This is going to be a good position to work on engaging some shoulder stability in a very short range. This is good for someone who's starting off with shoulder pain, a safe way to engage some strength without a lot of risk of putting a lot of pressure on the top of the shoulder. So I'm going to take a band, and if you have a regular like TheraBand, you can just tie a big knot in the end and throw it over the door. So I'm going to take this piece and just put it over the door, close the door, make sure it catches there, right? And then this is something I'll start off with someone who has a lot of pain on the top of their shoulder because it's pretty safe, right? So I'll step back so there's a small amount of tension on the band. And I want to think about my shoulder staying down away from my ear. And I'm just going to do little pulses in whatever amount of range is comfortable. So if I have someone who's very irritable, I may start them off just doing small pulses in this short range with the focus of squeezing down through here. You can see I'm kind of pulling my shoulder down and just doing little pulses for time. I stay in whatever range is most comfortable. Sometimes I'll play around with the angle and I'll start off here and I'll ask a patient, how does it feel here? Compared if you turn away a little bit, compared if you turn away more. I'm going to start off with whatever angle is the least painful. I'm just watching as I do this that I'm not letting my back fall forward and my ribs elevate. So I try and just keep hips tucked underneath me. This is something I would do more for endurance. 30 to 90 seconds. Slow controlled pulses, try to make sure I feel this, no pain on the top of the shoulder. And then I would progress someone from this position. Typically the more that I go out to the side, the more weak or the more threatening the motion is. But it's the same thing, this downward pressure tends to not be super irritable on the top of the shoulder. The only thing you have to watch out for, especially as I go wider, is I don't start to let that shoulder cave forward, right? So even here, as I pull down, I gotta watch that I don't pull down and let my shoulder blade rock up forward. So I always think about this down and back pull into my armpit, small motion. If it's fine, I can come all the way down a little further. Same thing in this position, right? But I just wanna make sure the further I go down, the more likely someone is to start to hike that shoulder and they may recreate that same impingement. So I just want to make sure I stay in a range where I feel like this shoulder can maintain a good position. I'm not having any pain. From the straight pull downs, I may even add in some small circles. Starting it straight or starting at the least painful position. All geared at engaging lower aspects of muscles that stabilize the shoulder, so it's a good place to start for anyone with superior shoulder pain.